really depends on the risk appetite of every company. I mean, and people can take these baby steps into moving into, and people are doing it. People are moving away from the typical para 4 into complex generics. Complex generics inherently will limit the competition that is there. Fewer players will have the technology to develop complex generics. So people are doing that. Then people are now moving into novel drug delivery systems. You go for a patch, you can go for an inhalation device. So all these are high risk. They are not the standard tablet that you would do with most of the para 4s. These are high risk, but what they offer is two things. One, they do offer an entry barrier to competition. So people will not be developing, everybody will not be competing for that same atorvastatin or Lipitor that is going to go off patent. People will decide that these are the only 8 molecules that I can focus on. I cannot focus on the 50 or 40 ANDAs that I used to file every year. So I think over the next 8 or 10 years, I can see a dramatic change in how many of our Indian generic companies, of course, they will still milk, or the bread and butter would be the oral things. But if people really keep continuing doing that, I personally feel that they will not be able to sustain in the marketplace, which is moving in a very different direction. So people have to slowly start moving away from this and slowly start investing into it, because this is not something, what we call as the product cycles for these things are much longer compared to our, the ANDAs or the para 4s that people are used to. So the product cycles are much more longer, and you have to invest for it to, and allow it to incubate for 2 to 3 years before it really starts maturing.